Hey, my name is Lauren Mussel, and I am in the class of 2027 at Scripps Mercy Family Medicine Residency Program in Chula Vista. And this video is going to be a little bit more about our OBGYN training. So as an intern, you definitely start off right off the bat getting a lot of OBGYN training. You'll have 8 weeks of dedicated OBGYN rotations, as well as a 2-week rotation that is nights where you're covering our OB service up at the hospital. And what these OB rotations entail is a combination of both covering our labor and delivery service, as well as going to outpatient clinics to learn more gynecological procedures, do prenatal care. So I'll talk a little bit about both aspects of those rotations. As far as our labor and delivery service goes, this is our first year where we are delivering our patients at Scripps Mercy Hospital in Hillcrest. And while there, we have a family medicine OB service that we cover 24/7, 365 days a year. So what that means is there is always at least one resident who is covering the service during the days, and also one resident who's covering the service during the nights. For our family medicine service at the hospital, we will admit all of our patients from the continuity clinic, our resident staff, as well as any other patients who have been receiving their prenatal care through the San Isidro system. So it really allows us to have a great volume of patients who come in that we can directly manage as their primary team. In addition to our family medicine service, we also have the opportunity as residents to work with the OBGYN hospitalist up at Scripps Mercy in Hillcrest. And so that means that we can, join on with any of the patients that they have who are low risk that are in labor or actively delivering. And it really provides an opportunity to increase that volume, especially for those residents who are very interested in obstetrical care. When you are up at the hospital, you are doing it all. You will be managing any triages that come in the door, laboring patients, obviously doing deliveries. And then if you are interested, you have the opportunity to scrub into C-sections with certain OBGYNs if you're so inclined. And in addition, of course, we will be doing postpartum rounding. And what I think is really unique about our service is with postpartum rounding, if it was a family medicine patient, we then also are the primary team for their newborn. So when you're postpartum rounding in the morning, you're not only seeing the mom, but you're also seeing the baby. And sometimes you did the delivery. And so it's a really great opportunity to experience the continuity of family medicine. And so during your second and third years, you also will have dedicated OBGYN rotations, as well as covering some night shifts. And for those who are really interested in practicing obstetrical care after residency, starting your second year, you can be involved in what's called the Maternal Child Health AOC, or Area of Concentration. And we have another video that will explain a little bit more about the opportunities within that area of concentration. In addition to being on the labor and delivery service during your OBGYN rotations, you will also be rotating through several clinics in the community that are staffed by our faculty. Most of them are exclusive, like women's health, OBGYN care. So you'll have the opportunity to work with our faculty and learn a lot of gynecological procedures, of course, pap smears, but more. In addition to that, you also get to learn how to do and become proficient in EMBs, Nexplanon placements, IUD placements, colposcopies. Really, there's a broad range of procedures that we get exposed to during those outpatient clinic rotations. You also have the opportunity to be in your continuity clinic during those rotations, and you'll have specific days where you are only seeing prenatal patients or newborn patients. And so it really is a great opportunity to kind of reinforce what you're learning in the hospital on deck, and then also get to see the process of prenatal care in the clinic. So I part of the reason why I chose Scripps was because I knew it was a very OB heavy and very OB passionate program. And I definitely have experienced that passion and commitment to our patients in terms of both our faculty and residents. We are committed to providing great obstetrical care to all of our family medicine patients. And it's been a great experience so far. And thank you for watching this video. I hope you all really enjoy your interview day, and we look forward to getting to know you.